Hello everybody, this is Dr. Nadia Fouladian. So here we're going to start the second video of the male reproductive system. So far we talked about some parts of the reproductive system including the testes, and we talked about the spermatogenesis, how the sperm is formed inside of the testes. Now when the sperm is formed, it's going to go inside of some tubes so that it can get out of the body of the male, right? We call those ones male reproductive tract. Male reproductive tract consists of epididymis, ductus deferens, and at the end urethra, right? And the whole function of these parts of the reproductive tract they are involved in the functional maturation, because when the sperm is formed, you will see that it is not fully functional. It needs even more maturation. We're going to talk about that. They are functioning in nourishment of the sperm, give some space for the storage of the sperm, and transport it to the outside of the body. Now let's go over each one of these one by one. So first, regarding the epididymis, so we talked about before epididymis, right? After the seminiferous tubule, that we have a straight tubule, you have rotated testes, and you have the epidydym ductule. Then now you go to the epididymis. Now inside of the epididymis, we have a fluid that currents in the straight tubules move sperm cells to the epididymis. Sperm cells are physically but not functionally mature. We said that the physical maturation of the sperm, it happens when you have spermiogenesis, right? So with that one, spermatid changes the shape to the sperm, but is not functionally mature yet, can't move independently. That's the thing that is still missing when it gets to the epididymis. Now, epididymis consists of three parts. The first one that is located on the top of the testis is called head. This one receives a spermatozoa, means sperms, via the efferent ductule. Sorry, I think I called epididymic ductule, but these are efferent ductule. But then after the head, we have the body. That's the coil tubes pass through the body, and then finally they get into the tail. That tubes begin to uncoil to become a single tube called the ductus deferens, right? Here you see the structure. You have seen the testis before. You see that you have the tunica vaginalis here. Then under that you have tunica albuginea that makes all these lobules here. We talked about the seminiferous tubules, how they go through the straight tubule, then they get to the retotestis, then they go efferent ductules, and then finally get to the epididymis, right? Pay attention that they may call these ducts by themselves ductus epididymis, but the whole organ is called epididymis. Just pay attention, if you see ductus epididymis, it just refers to the ducts that are making the epididymis. All right? So as you see, you have a head part here, you have the main part that is the body part, and then finally they start uncoiling and make the tail here. And at the end, it connects to the ductus deferens, that you see that here goes up and continues toward the urinary bladder. So these are the structure of the epididymis. Now regarding the function of that, it has several functions, including monitoring the composition of the fluid produced by the seminiferous tubule, right? So it just monitors that, adjusts that to see that if something is missing, extra, and all this. Recycling center for damaged spermatozoa. So this is a line of production, right? If some of the spermatozoa haven't been formed well or they are damaged, this is like a line of production, right? This is the place to get them out of the line and recycle them to be produced well again. It stores the spermatozoa for further maturation, and this is the one that causes the maturation of the sperm. That's the functional maturation, that it happens the way that the spermatozoa remain in the epididymis for 2 weeks. And it takes 2 weeks to pass through the epididymis, and this is the time that is necessary for the sperms to get mature. Mature sperm cells are not motile until they undergo capacitation at the end. That is the one that enables them to change at the time of the zygote formation and fertilization, be able to penetrate into the ovocytes, right? So regarding the maturation of the sperm is not finished inside of the epididymis. They need to remain in the epididymis for 2 weeks, but then after that, they need to go under capacitation, as we said, but that one happens outside of the epididymis. 2 steps is involved in capacitation. First, for the maturation of the sperm. First, that the sperm cells becomes motile and they are able to move when mixed with the secretions of the seminal gland. Seminal gland are the glands that I just showed you at the beginning of the chapter. They are located on the back of the urinary bladder, and they pour their secretion into the urethra, and then sperms comes and goes into that secretion. So those secretions of the seminal gland are necessary for the sperm to become motile and be able to move. And then they become capable of fertilizing an egg when they expose to the female reproductive tract. So it means that until they meet an oocyte, they go to the female reproductive tract, they are not completely mature and they do not become capable of capacitation until they go into the exposed to the female reproductive tract, because there are some secretion inside of the female reproductive tract that starts that step of the process. So here again you see the slides that you have a section of the several seminiferous tubules next to each other, and we discussed this once before, that the sperm produced from the capsular layer outside here from the spermatogonium, and as they are changing to the primary spermatocytes, secondary spermatocytes, and finally spermatid, and then finally functionally mature to a sperm, and they get into the lumen of the tubule here, right? As you see them here, several of them, right? Now, after the sperm comes from the seminiferous tubules and get into the epididymis, continue, goes from the head to the body to the tail and all those ones. It takes about 2 weeks to remain there, and then after that it gets to the ductus differens. Ductus differens, also called the vas differens, and that is the one that is referring that when we are going to do a male sterilization, so that the prevention of the pregnancy on the side of the male, we do the vasectomy. And ectomy means cutting, vasectomy means cut off the vas deferens, right? So just bring the tube out and then cut it and ligate it on the 2 sides, right? So that the sperm cannot continue its way to get out of them. And vas deferens begins at the tail of the epididymis, as you have seen, and ascends into the abdominal cavity to the inguinal canal, the one that we showed and talked about as the spermatic cord. Now, regarding the ductus deferens, it curves around the urinary bladder when it gets into the abdomen. As we said that the gonadal vessels, they go their way toward the kidney up. But the ductus deferens separates when it gets into the abdominal cavity, go behind the urinary bladder. After passing the ureter, it goes to the back of the urinary bladder, then descends back toward and through the prostate gland, right? So ductus deferens is joining the urethra that is passing through the prostate gland. You remember we called that one prostatic urethra. Now, before entering the prostate gland, the ductus deferens expands into the ampulla. So the final parts of the ductus deferens is more dilated, and we call that one ampulla of the ductus deferens. Then this ampulla joins the excretory duct of the seminal gland. Seminal gland is an exocrine gland. It has some secretion. It has a duct that brings those secretions out and pours into a lumen, right? So the duct of the seminal gland, the excretory duct of the seminal gland, joins the duct that comes from the ampulla of the vas deferens, and these two together make a duct that we call it ejaculatory duct. Now, ejaculatory duct is the one that empties into the prostatic urethra, right? So in this way, the sperm has come from the testes, passed through the epididymis, come through the ductus deferens, and now pours into the prostatic urethra. At the same time, the secretions of the seminal vesicle or seminal gland also comes and pour in the same place into the prostatic urethra, and both of these pass through the ejaculatory duct, right? So far so good. So here you see that you have the testes. When a sperm is formed, goes through epididymis, through ductus deferens, get passed through the inguinal canal, get insides of the abdomen, passes here toward the posterior, toward the urinary back of the urinary bladder, pass over the ureter and goes behind the urinary bladder, and now makes an ampulla. I haven't been seen here. It might be this one. Yeah, this is the one. Oops. Yeah, that's a bigger picture. Let's go. Oops. So here you see the cut section of the cadaver, the same structures that you see here. Might be hard to follow, but still you see many parts over here. Now, if we go from the back of the urinary bladder, from the posterior view, you see the vas deferens that have come here from the anterior wall of the abdomen, passes in front of the urethra and goes behind the urinary bladder. This is the ampulla of the vas deferens that you see here, and after that it joins the ejaculatory duct that comes from the ampulla of the vas deferens, and also comes from the duct of the seminal gland that you see that here. Here have been cut the seminal vesicle or seminal gland so that you see inside of that one. Then finally, this ejaculatory duct pours into the prostatic urethra. So this prostatic urethra brings the urine and also sperm and the secretions of the seminal gland toward the outside, just at different times. Okay? Now here you see that after the prostate gland here, you have these muscles, the skeletal muscles that you have the floor of the pelvis here, right? And you see that in this part of the urethra that passed through this layer of the muscle is membranous urethra. And next to that, you have these two glands that they are bulbourethral glands. So pay attention. Bulbourethral glands are at the level of the membranous urethra, but they have their duct, each one of them, that they pour the secretion of the bulbourethral gland to the next part of the urethra, because from here starts the spongy urethra. So bulbourethral gland pour their secretion into the spongy urethra. So that's it. This picture shows the structure of the how the vas deferens joins the seminal vesicle to make the ejaculatory duct for the into the prostatic urethra. Now, regarding the urethra, as you have it in the urinary system, in the male divides into three regions: prostatic urethra, membranous urethra, and spongy urethra, as I showed you. Prostatic urethra extends from the urinary bladder through the prostate gland. Membranous urethra passes through muscular wall of the pelvic cavity, and spongy urethra passes through the penis all the way to the outside. And sometimes spongy urethra is called penile urethra because it passes through the penis. It's called spongy urethra because it is in the middle of the corpus spongiosum. We're going to talk about that one soon. Corpus spongiosum is part of the penis. That you see that here you have the prostatic urethra, you have the membranous urethra. Membranous urethra is the shortest one, and then you have the spongy urethra. It starts from here all the way to the outside. This is the longest part of the urethra in the male. This tissue that you have around the urethra, spongy urethra here, is called corpus spongiosum, and that's the reason that this part of the urethra is called spongy urethra to that one. Also, you see that here, you see the urethra here that pass through the spongy urethra. So that was regarding the whole path of the sperm. It starts from the testis that is produced over there, then how it is transferred through the epididymis, vas deferens, and then finally gets into the urethra to go outside of the body. Now, male reproductive system, as we said, any reproductive system has some accessory glands. In the male, there are three glands that are associated with the male reproductive system. Seminal glands, sometimes we call it seminal vesicle, because of the shape that you saw. It's all like some sacs that you have put together to make that gland, right? Then you have prostate, and you have vulvo-urethral gland. The other name for that is Cooper's glands, right? So in some books you may just see the other names like seminal vesicles or Cooper's glands. So it's good to know both of them. Now here you see the location of the prostate gland that you have it here. You see the seminal vesicle or seminal gland, and as I showed you, the vulvo-urethral gland are located here that give further secretion into the spongy urethra. Now regarding these glands, starting from the seminal gland, seminal glands are produced in about 60% of the semen volume. Semen includes all the fluid of all these secretions. We're going to talk about that, what other things included in the semen, that is the fluid that is coming out of the urethra of the male at the time of the ejaculation. But 60% of that is coming from the seminal gland, so that's the biggest portion. Then seminal fluid that is coming from the seminal gland consists of a high concentration of the fructose as the source of the energy. It has some prostaglandins and it has some clotting factor. Those clotting factors are the ones that when the semen gets out of the body, it loses its watery consistency and becomes like a jelly-like structure, right? And prostaglandins, they are the ones that when they get into the female reproductive system, also it has some function over the female reproductive end also. Now, with these contents that come from the seminal gland empty into the ductus deferens during the ejaculation. That's a mistake, because these are empty into the ejaculatory duct. They're not getting back into ductus deferens. So sorry about that. That's a mistake here. We have to fix it. And seminal fluids will enable sperm to become motile. So these are one factor that help in the functional maturation of the sperm. That's the function of the seminal fluid. Then we have prostate gland. We have the fluid that comes from the prostate, prostatic fluid, secreted into the prostatic urethra, and it makes about the 20 to 30% of the semen volume. So as you see, it's like half or less than half of the fluid that comes from the seminal gland, right? These secretions are weakly acidic. And the things that we have inside the secretions of the prostatic gland, we have some enzymes that prevent sperm coagulation in the vagina, because I said we have some clotting factor that we don't want that happen over there. And we have seminal plasmin. Seminal plasmin, pay attention, is not coming from the seminal gland, is coming from the prostate gland. And this is an antibiotic believed to prevent UTI in male, right? So that was regarding the, and pay attention, that was regarding the fluid that come from the prostate gland, and they have the secretions of the prostate gland, they have a milky appearance. Then we have the bulbourethral gland, that there are pair gland located at the base of the penis, produce about only 5% of the semen volume, and their contents empty into the spongy urethra, as I showed you, immediately distal to the body wall, the end of the membranous urethra, the floor of the pelvis, right? Now, the secretion that we have from the bulbourethral gland, they are consist of a thick, sticky, alkaline mucus, right? So this one takes the acidity of the acidity of the prostatic secretions away. They neutralize urinary acids that are remaining in the urethra and provide lubrication for the tip of the penis. So these are the function of the secretion from the bulbourethral gland that you have seen them here. These are bulbourethral gland, goes to the spongy urethra. Then you have the seminal gland that pour into the ejaculatory duct, and also you have the prostate gland. Prostate gland pour their secretions directly into the prostatic urethra by several very small tiny ducts that they have, and they pour all secretion directly into the prostatic urethra. Now, what is semen? Semen is the fluid that releases during each ejaculation, that is about 2 to 5 ml of the semen. So ejaculate material consists of sperm cells. So those are the ones that had remained, like for example, epididymis and ductus deferens, each one of them, besides the function of the maturation and just the passageway, they are a place that some sperm can remain them and store them for the time of the ejaculation, so that they do not have to come all the way from the testis, right? They are already available behind the door. As soon as all the reactions happen, sympathetic, parasympathetic, and all those ones, they become available and they are ready to get out. So through the semen, right, during ejaculation. So we have sperm cells that we have a normal sperm count that it should be about 20 million to 100 million per ml of the semen. And we have 2 to 5 ml of the semen. So during each ejaculation, about 5 million sperm may become available, right? And this is necessary for the fertility. If like the sperm count goes below 20 million per ml, they most probably are not able to fertilize their oocyte. Now, besides the sperm cells, we have seminal fluid. Seminal fluid is not only from the seminal vesicle. 60% of that is from seminal vesicle, 30% is coming from the prostate, 5% comes from the bulbourethral gland, and 5% comes from the epididymis. All these fluids are making the seminal fluid. And besides this one, we have some enzymes inside of the semen that they dissolving vaginal mucus and act as an antibiotic, right? All these ones together make the semen that is 2 to 5 ml of that is ejaculating through 5 ml of that is ejaculating during each ejaculation, getting out of the penis, right? Now let's have a few words regarding the penis, that is the external genitalia, and see about its structure. So far we talked about how the sperm is formed, how it is become functional, and the maturity and all those things that depends on all the secretions and all this. Now regarding the penis, it divides into 3 regions. First one, it is root, then it is body or shaft, and then finally it's glands of penis. The root is attached as base of the penis to the rami of the ischia. You remember the hip bone, that it has ilium, ischium, and pubis. So the root of the penis is attaching to the rami. So remember, you have a ramus, ischial ramus, right? So ischial ramus that was located on the inferior part is attaching to the root of the penis, or better to say root of the penis is attaching to ischial ramus, one on each side, right? Then we have the body or shaft of the penis that consists of erectile tissue. We're going to talk about this erectile tissue and the part that we have. And finally, we have the glands of penis that is the expanded distal end of the penis that surrounds the external urethral orifice. So, just reminding you regarding the urethral orifice that you have the external urethral orifice that is a little bit dilated at the very end too. So this last part is called the glands of penis. And here you have the body, and here you have the root. We're going to see more pictures of that. Now, we said that we have the erectile tissue in the penis, that in the body that we have, it consists of 3 cylindrical columns of erectile tissue. What does it mean, erectile tissue? It means that, do you remember what is erection? Like you had erector spinae muscle. They were the muscles that were enabling the, for example, back of the body to become straight, right? So that's the meaning of the erection, to stand straight, right? So that's the ones that enables the penis to stand straight. Therefore, we call them erectile tissue, right? So we have these 3 columns and some blood vessels. These 3 composed of 2 posterior corpora cavernosa and 1 anterior corpus spongiosum. The first thing, reminding you, when we're talking about the posterior or anterior, we're talking about the anatomical position, and that's the one that at the beginning we discussed about that. What is the anatomical position for the penis, right? Now, we have 1 corpus spongiosum. Corpus means the body, right? Like corp, right? And this is the one that is corpus spongiosum, is located toward the anterior. And remember that the spongy urethra passes through this cylinder structure, erectile tissue, right? Then we have the other 2 on the posterior side, that as they are 2 corpus, you can say that it is corpora, right? Means more than 1 corpus. And we call them corpora cavernosa, right? So, to see the structure of those ones, we have the corpora cavernosa, that it has the deep artery of the penis goes in the middle of each one. In the center of this tissue. And each corpus cavernosum, this is the singular for each one. So we have corpora cavernosa for both, corpus cavernosum for each one. Each one extends posteriorly, forming a crus of the penis. Crus here means like a leg. I will show you the picture. You see it means like extension, the end of the tissue. That makes like a crus of the penis, and each crus is bound to the ramus of the ischium in each side, right? That's the way that these two corpora cavernosa are attaching to the ischium so that it's tight in position. Then we have the corpus spongiosum that surrounds the spongy urethra, and thickened proximal end of that becomes expanded and forms the bulb of the penis, as we're going to see. Now the other part that we have for the penis is called the prepuce or foreskin. That is the skin that surrounds the tip of the penis. This prepuce attaches to the neck of the gland and to neck of the glands of penis, and perpetual glands in the skin of the neck and inner surface of the foreskin secrete waxy smegma. This smegma encourages bacterial growth because it's like a very deep pouch, right? So it's hard for material to get out of that, so that's very susceptible for the bacteria to be able to grow them. And this can lead to infection and inflammation of the area. Therefore, it is said that the surgical removal of the prepuce, that is called circumcision, avoids this problem, infection and inflammation, and even some of the studies have shown that it may decrease the rate of the cancer of this area too. So this is common in some religion, and some people are doing this, some of them are not doing this. These are just due to the different behavior and culture that people are doing, but these are some studies that have been shown that this might be beneficial. So that's regarding of the glands and the prepuce that is covering around that, and their secretions that we call them smegma. So here you see the picture of the penis. Here you see pay attention that we said that the anatomical position is the erect position of the penis here. Therefore, this is the anterior or ventral surface. This is the posterior or dorsal surface. In the ventral side, you have the corpus spongiosum. In the ventral side, you have the corpus spongiosum, ventral side. On the dorsal side, you have the corpus cavernosum. For the two of them, corpora cavernosa, right? You see the crus of the penis here that is attached to the ischium, to the ramus of the ischium. You see that on this side, you have the same on the other side. You see the glands of the penis, you can see the neck of the glands here, and here the prepuce in this area have been removed so that you see the glands under that. The prepuce is the skin that is covering out of that, like make a pouch, deep pouch here in this area. So when you look at this section that you see, this is a good picture that shows the continuity of all the structures here, like from the testis here that go into the sperm, goes to the epididymis, then it continues in the vas deferens and then go behind the urinary bladder, joins the ejaculatory duct, and then goes into the prostatic urethra and goes to the urethra and goes all the way out of the body here, and shows all the glands that we discussed about them before, the same. Now regarding the penis here, you see that you have these structures here, that you have the corporal, these have been opened completely from the side so that you see them as have been expanded, right? So you see that you have the urethra, and around that you have corpus spongiosum that you see at the end is become, the urethra is a little bit dilated, And the corpus spongiosum also at the end of the urethra make this bulb of the urethra here, bulb of the penis here, sorry. And the bulb of the penis is part of the corpus spongiosum, as you see here. Each corpus cavernosum, on the other hand, at the end has a crus of the penis and attaches to the ischium, as I showed you. Now, this was the longitudinal section, right? Although not necessarily all of these ones at one level, just have been drawn so that you can have the continuity, right? Now here you see a cross section of the penis. If you got a section like this, you see that you have, this is on the ventral side, you have corpus spongiosum, in the middle of that you have a spongy urethra. You have two body corpora cavernosa here. In the middle of each you have a deep artery of the penis. And then the other things that you have on the dorsal side, you have dorsal artery, because it's in the dorsal, we call it dorsal artery, and vein, and the nerve here, because those are on the dorsal of the penis. And looking at the tissue, you see this has lots of space here, and that's the one when the fluid comes into that, makes that expand, and that's the one we call it erectile tissue, and cause it to become erect. Now, regarding the erection of the penis and control of that, parasympathetic nerves are activated during erection, and smooth muscles in the arterial walls relax. When the muscles relax, what will happen? The arterial vessels dilate, and arterial vessels and vascular channels within the corpora cavernosa and corpus spongiosum become engorged with the blood. And that is the one that, because now the arteries are more dilated, more blood comes, right? And when it goes into this area, therefore erection occurs, right? That's what is controlling the erection. And as you see, it is under control of the parasympathetic. It triggers with the parasympathetic. Now, regarding the semen release, that is called, we call it ejaculation, is under control of the sympathetic activity. That we have one part, we call it emission, and one part ejaculation. Emission is when the sperm mixed with the semen by peristaltic actions of the smooth muscle. It goes in the ductus deferens, seminal gland, prostate, and bulbourethral gland, right? So all these ones are moving the sperm and the semen that we have from the fluid all around from these ones, they are moving forward, right? And then the final part, that is ejaculation, that's a powerful contraction of the muscles, that those muscles are ischiocavernosus and bulbospongiosus. That these push semen toward external urethral orifice, and it happens through the sexual activity, right? So these two muscles are that are causing the ejaculation, and the powerful, fast contraction of these ones push semen toward external urethral orifice. So these two, emission and ejaculation, are under control of the sympathetic activity. So that was the way that the structure of the penis, and this is the end of part 2 of the male reproductive system.